Hey, Cam followers, you have got a double whammy. So we were here yesterday with the lovely Matt Gurney, and tonight, because it's Christmas and all, we have the lovely May joining us. And this is a really biggie as well. So I'm stashing them all up for Christmas. I met the lovely May over at a rehab conference in Ghent, and she just blew me away with her dedication to rehab, physio, and management of chronic pain and musculoskeletal and neurological dysfunction. And I was like, please, can you do a Facebook Live? So thank you, May. I'm so grateful that you're finding the time to do this for us. As normal, Cam followers, if you have questions, please post them and we will get to them to the best of our ability. Tonight, I'm going to let May start the conversation. She's been in the rehab world for quite a while, and there's certain things that come up again and again and again, and we sit there going, I want to tell the world this because it's so important, and I'm going to let her lead. So please tell us a little bit about yourselves to start, and then get the conversation started. Tell me what you want to say to the world.
Okay. Thank you for the introduction. Well, first of all, I have to say I'm not a native speaker, so when it gets completely gibberish, you'll have to translate for me or whatever. I'm an animal physiotherapist in the Netherlands, and I've been working quite a while, like you said. Actually, since before the profession was there in the Netherlands, so I helped.
Pioneer.
Yeah, I helped founding the professional association and helped organizing the education. And I mean, I was so lucky to be a pioneer and to be able to make the profession worthwhile and something that people are taking in account. I think that's what you should say. I should say.
Oh yeah, absolutely. I think I've met a few people that were physiotherapists, rehab specialists, like rehab focused. 10, 15 years they started their interest, and I can't imagine how hard it must have been, because I know that the vet profession is only really beginning to really follow and slide into, oh my God, this has got a lot of, evidence. This is important. So
yeah,
it's been really tough back then.
It's not tough. It's fun. It's really fun. You shouldn't get frustrated, but it's really fun because I know it's the purpose is so worthwhile. It's so important.
How did you get into it? And go on, tell us how long ago you started doing your rehab, physiotherapy, etc.
Since 1984.
There's a book, isn't there?
Well, actually, I studied. I was at veterinary school for a few years, and then I quit doing that, and I started doing physiotherapy. And I wanted to combine the two. I really thought, why, if I can treat humans, why can't I treat animals? It was so obvious to me. So I started doing that, and then I started knowing other people who were doing that, and we got together and made a profession out of it. But it's really fun, and it's like treating a child. Yeah. And I speak to the owner like I would speak to the parent of the child, and it's more or less the same, but it's more fun.
It is a pretty you're not really bigging up how hard it is to create a course and a profession. It's a big deal to bring it all together and create what you guys have been creating. So thank you for your persistence and endeavors. It's very, very good. So let's start off getting to the point. What kind of things do the CAM followers need to know from your perspective? So having worked in the industry with a focus on the physiotherapy, rehabilitation side of things, what things do we need to shout about?
Well, what always made me very sad is that people came to me with their dog far too late, because it's so hard to notice as an owner that your dog has difficulties. that your dog, that something's changed. And that's actually what I really, really would like people to do. And not only look at their dog, because we all look at our dogs, but observe their dogs. And don't take the changes you see for granted, because a change is never something that suddenly happens and something that doesn't have any significance. If there's a change in posture or in behavior or in maybe the weight, if there's a weight shifting, it always has significance.
Yeah.
We have to find the significance, and it's like we as people, but also dogs, we're very good at compensating.
Yes.
So when the difficulty in your body starts, we compensate and we try to avoid the pain, and and that's the same thing dogs do, and it's even better at that than we are, because they have 4 feet. So they start to shift their weight a bit. They start to do everything they can to avoid the pain and the discomfort. And then finally, when you see something, it's been going on for quite some time, and you've missed that time. And that's such a shame. And you can notice it if you look at the small changes there are.
I think it's from the owner perspective, and because I am newly enlightened, so I'm small animal vet for a good 11 years before I started seeing things and going, that's not right. Yeah. So I can see both sides, and I know from an owner perspective, they quite often feel that they're being trivial, they're being silly by pointing out minor changes to their vet, and things like, I can remember someone said to me, doesn't wag his tail so much anymore. And I can remember when I was unenlightened that I said, oh, you know, possibly just changes in his behaviour, and you know, old. And I remember saying it because I had no answer, and people that would say, oh, he just doesn't like doing that anymore. And again, as a vet behind that table, I would say, oh well, he's probably just growing up. And I'm like,
but you're not the only one. I wasn't enlightened at first, of course. So when our first dog started, she sometimes had these episodes of not being well. She wasn't unhappy, but she was different. Yeah. And we thought, well, it's just one of her moods. And only at the end of her life, we noticed that she had a major back problem.
Yeah.
And I never knew. And my husband, who's a vet, never knew either, because we didn't know how to look. And I understand that as a dog owner, you can't diagnose things like that, but you can notice the changes in behavior, and you can ask a physiotherapist or a vet to look at it.
Yeah. Well, what I did do, and the lovely CAM team, I have to praise them because they are an incredible group of professionals. What we got together and thought about is, let's learn from our unenlightened selves to now how we think, and how can we bridge that gap. And something that I'll put a link to after this live is that there is a printable tool off the website. It's called Suspicion of Chronic Pain.
Yeah.
A piece of paper, and on it has got the CAM factor, which is behavior change, posture change, physical changes, capability and gait changes. And by each one is 3 dotted lines. So you as an owner or a dog walker or a pet professional, if you're seeing changes and you're like, is this significant? You can write it into the category it's relevant to. So if he's got an arch to his back, then that will be posture. If he's got a behavior change, that will be at the top there under behavior. And then you bring in your information together, your observations, and looking at it and going, wow, that's quite a lot of change. And now I can take it to my vet and say, look, I've got behavior change, I've got posture change, I've got physical changes. I think there's something going on. Whereas I did find, being the vet, when people had turned up and went, doesn't use his tail very much anymore, I'd be like,
yeah, I know. What I've learned is that we as therapists, we have to take our owner seriously. And I think you as an owner should insist upon your vet or your physiotherapist to have a proper look at your dog. Because you know best, as an owner, you know in your heart or wherever you feel that something's wrong. Then don't let yourself be pushed aside like, oh well, it's nothing.
Yeah.
It's not a big deal, because you know.
It's kind of interesting though, and what we will be tackling after Christmas with the lovely help of a guy called Andrew Hales, who is a dog behaviourist but also human psychologist, is that as a vet, I can remember the cases where I did try and flag up that these subtle changes could indicate pain. The owner would just shut down, didn't want to know, know, bury head in sand, not happening, I don't want to hear this. And you as a vet would think, Christ, I feel really uncomfortable now. I've tried to help and I've been rejected, and I've almost been made to feel guilty for suggesting that there was a problem.
Yeah.
So I have a lot of memories of that may inhibit me saying something in the future for fear of having such a negative reaction. But then also, you know, the reverse, maybe it's happening to owners too, who have said something in the past and the vet has said, no, that's nothing. And they feel therefore inhibited to say something in the future. So looking at it with no blame being laid anywhere, how can we help everybody? And that's what Cam's trying to do, is taking this resource and having amazing guests like you, that a vet could watch this and go, oh, crikey, never knew that. And this key opinion leader has said that. We've also got the ability that the owners can hear the same things and hopefully get the confidence to suggest. So that's what Cam's trying to do. So thank you for helping us try and bridge this miscommunication gap, really, I think.
You know what, because I have the same experience, that I tell people that their dog is having a problem with their back or a leg or whatever, and people, they scare. They don't want to hear that, and of course they don't want to hear that. But what I often do is I compare what the dog has to what they might have.
Yeah.
So they understand it more easy. But it's a complete normal reaction, though.
So it is a normal reaction, and I think we did some work for Elanco recently, and we got some feedback about, you know, the lectures that we gave, and I think a real feeling amongst everybody, the lecturer and the lecturees, whatever the word is, we need to tackle the conversations more. You know, I think that your job and my job relies so much on communication, expert communication, being able to adapt to that person, that situation, their responses, and get the best out of them. And I don't feel that the vet system we have currently gives us enough time to make those kind of character assessments, to say it in the right way to get the best out of people. So yeah, it is a tricky one.
Yeah. It's actually something we're not taught to do, but we should.
Yeah. Did you be teaching about the conversation?
Whether I did do that or get that?
Yeah, when you, like, with the physiotherapy training, do you get...
Well, that's so long ago. I'm really not sure. I'm sorry.
I love that.
I probably didn't.
No, well, I know that we do still struggle with it. I think another area that I'd love us to talk about whilst we drift through the experiences you've had is really summed up by an experience I had only about 3-4 days ago. And a girl that I know, his dog has just had a potentially slip disc. So that was her terminology. Hardly know her, but she mentioned it in passing. And the dog is in crate rest. So it's a very old Jack Russell. It's like 13, 14 years old. And I was like, oh, I can help you with that. I can help you with that. And there was just this drifting away of, no, it's fine. No, it's fine. And I'm sitting there going, that's likely to be really painful. that is likely to really hurt. But because dogs, as you say, have such amazing coping strategies, I don't think the public have the full understanding of what amount of pain they will put up with before they shout about it. And I see this on a daily basis. We have dogs come in, and because I have imposter syndrome, I sit there going, oh my God, I'm not going to find anything wrong with this dog. And then you get your hands on and go,
yeah,
wow, you know, that hurts, this hurts, that's not right. And you think that that dog, as you say, months, years carrying it, and you say, I have more respect for dogs than I do people.
Yeah. Oh, yeah. But do you know, when you are looking at a dog, when you're assessing a dog, I don't know whether you do the same, but I'm constantly talking to the owner. I'm constantly saying what I see and explaining things. And I think that's part of making people aware of what's happening. Because if you have a dog with back problems and you push lightly on the back and you see the skin so tingling, what do you call that? Wrinkling.
I call it like a skin crawl because it drops back.
And if you ask the owner, when you stroke the dog, do you feel the same? When you try to brush the dog's back, do you see the same? And they say yes. And then you can explain that it's part of their discomforts. That's it's something that the dog shows that it's in pain.
Yeah, but and the sad thing is that, you know, people are still, excuse me, people are still hanging on to this whimper, cry, yell.
Yeah. And that's the last thing a dog does.
It's the last thing.
If at all. Yeah,
absolutely. And like Luna proved it to me the other day. So Luna's my little 1-year-old dog.
Okay.
I didn't stand on my 1-year-old child. I accidentally stood on her foot. Oh my God, you would have thought that she'd been mauled by a bear. The noise.
Yeah.
But I know that Holly, my older dog that passed, the amount of pain that she was carrying, she never said a word. Never a word. And I think another thing that we at CAM are trying to help people do is realize that animals express pain the way that we do. We have behavior change, capability change. And we need to let go of this belief that they have to be yelping or seriously, you know, lame or not willing to move to be painful.
But they're just like us. I mean, I don't know how you are when you're in pain, but I tend to go away, sit in a corner, be very quiet and want to be alone. But there are others, and I know some, that really want all the attention in the world because they're in pain. I mean, all these differences, you see them in people, you see them in dogs.
Yeah. No, you do. It is really fascinating. And I admit I'm fully obsessed. I'm like one of those, now I'm converted. I just want to know how we can fix the problem. I think I feel a lot of guilt that for 11 years I didn't pick up on all the cases that needed help. But I find it fascinating.
It is. And you shouldn't, sorry to intrude, but you shouldn't feel guilt. You should feel happy because you are now aware of what's happening. There are so many people that at the end of their career even don't know what's happening. There are so many vets that don't realize that there are so many dogs with dog problems, with back problems. So you have to feel proud, actually.
Well, thanks. But are there any kind of, so thinking about the therapists that watch this page, so we're now going to target them. Are there any tips that you could give them about these conversations and things that you found yourself regularly using or examples to help with clients that aren't fully aware of how uncomfortable their dog is or something along those lines?
You know, what I find very, very easy to do, and I always do that, I'm a lazy housewife. I don't like housekeeping. So here's my confession for today. So what I do when I come home with my dog, I clean the feet. I make sure I always have an old towel at the door, and I clean their feet. And if you do that, you can feel whether it's easy to pick up their feet or not. And if there's one foot that suddenly isn't very easy to pick up, that means that there's something wrong with another foot.
Yeah.
Sometimes diagonally, sometimes at the other side, but you have to check the other feet for stones between the toes or little wounds or maybe something worse. But that's one so very basic and so very simple.
Yeah,
And you can do that on a daily basis.
Yeah, I think the outrageous one that I do a lot as a vet is I wait for a little bit of a silence and then I go, am I in pain? And they look at me and you can see them go, where are we? This is about my dog, not about you. And then when they say, no, I'm like, yeah, I have back pain and I've got hip pain at the moment and done something to my foot, but I still come to work and I still have to pay my mortgage and I still drive and I still go shopping at Asda or wherever. You can still function, but actually carry a significant amount of discomfort. And I know you can see the penny starts to slightly drop there. And I found it kind of lifts a bit of a barrier. Another thing that I regularly use is, did you know that 1 in 5 people worldwide have moderate to severe pain?
Yeah.
And then I say, so the waiting room's got about 8 people in there at the moment. So that means law of average, there should be probably nearly 2 people in there. I don't see them screaming and I don't see them limping and whimpering. So we actually as humans carry pain without expressing it. Why should we expect animals to do something completely different? So it's a bit outrageous, but I've used it again and again and again, and it does seem to work very, very well.
It does, yeah.
Yeah. So if you had the opportunity to kind of give owners, let's go to the owners now. So we're going to drift around. We're going to do owners and we're going to do vets, and we might keep going around in circles. Owners, what kind of advice would you give, knowing what you've been doing for the last however many years? I'm not going to say.
It sounds very simple, but I think a major tip, and it's also difficult, is observe your dog.
Mm. Yeah.
Simply observe your dog. Not look at it, but observe it. It's like you when you talk about food, I always say you have to feed with your eyes, because you can see whether the dog needs it or should have less or more. The same thing you do with the whole dog. Observe it. And
I've met people that have taken a photo of their dog every year from the same angle.
Yeah.
Yeah. And they pick up on things like the slope of the back changing, you know, dipping of the hind limbs, thickening of the neck. So they pick up on physical and postural changes.
It makes it visible.
Yeah, and I've also met people, they tend to be more in the dog, like agility, dog sport world, that they don't just see a vet once a year for a vaccine. You know, they see a physio, and it's part of their annual checkup. They will go and have a full assessment. And I think that is a really good idea too, because I hope the vet profession doesn't mind me saying this, but we don't get taught how to muscularly assess dogs. We're taught joints, we're taught nerves.
Yeah.
Actually feel muscle change, how the tone of the muscle, the loss of the muscle, the responsiveness to the muscle, how does the skin feel over the muscle, is not something that I had in my syllabus. And I know it isn't in the syllabus now.
Yeah.
So I think for me, for advice for owners, is it is worth the expense to say, in my annual expenditure, predictable annual expenditure on my dog, I know that I want to have a good full body palpation. Yeah. I think that's another good.
And especially if your dog is a sporting dog, because every sporting dog is a top athlete. Every sporting dog always goes for 100%. So if you do whatever sport with your dog, please have an annual checkup. And I did that for years for the local what's it called? The
Agility clubs.
Yeah, thank you.
Yeah.
Thank you. Yeah.
That's good. That's a big tip for therapists. Get in there with swimwear, you know, especially if you're a new therapist, getting your hands on to healthy dogs as well as old dogs is a brilliant learning tool.
Yeah. It's a learning tool, but also you'll be amazed how many dogs will have some kind of ailment, some kind of discomfort. Maybe it's minor, but remember, even when it's minor, if you go to your agility afterwards, it can get worse.
Yeah, and another thing, if you get it nipped in the bud early, you can see
right.
in, you know, the capabilities. Yeah. So if still talking about the owner, so let's talk about some of the things that you teach and you've used. So let's go into the physiotherapy world, because a lot of owners don't really know what you guys do. I didn't. I'd be hands up, I did not have a clue. So I think I started getting more and more interested in about 2013, 2014. And it was just like Pandora's box opened for me. I was like, what is all of this stuff? And I think for me, I found it really hard to understand why tools that you use every day are not available at vets for pain control. So pulse electromagnetic field therapy, they're mats, they could be put in kennels. You know, lasers are becoming more, you know, accessible. But, you know, TENS, NMES, you know, just, you know, cryotherapy, thermotherapy, and all these things. I was thinking, why don't we use that in the vets? And for me, I was like, God, this is like a whole new language I've got to learn. So tell the owners about what sort of things physios routinely do when they're managing an arthritic patient.
I think that our most important tool is our hands. Not all those fancy things like laser and ultrasound or whatever, but our hands. That's our most important tool. Because, like you said, palpation, which means feeling the dog and feeling the muscle tone and everything. That's the most important thing I have. And it also builds a bridge between me and the dog, because once I touch the dog, I can communicate with it. And it sounds...
Yeah, I get you, but I know that there's going to be people going, switch off.
Don't listen to this. But if I say communicate, I mean that I can feel the reactions of the dog. And those reactions can be tiny, but they're there. Mm-hmm. And they're often too subtle to see, but you can feel them. Mm-hmm. So when I touch the dog, I can assess the dog in the best way possible. Yeah. But apart from that, and apart from using massage when you got a dog, you want to assess, and it's very tense. They can be very hard. If you massage the dog a bit, it relaxes and it's easier to assess, and that's what I use as a tool too. And it's something I teach the owners too, because they learn to. It's so nice to see that I've learned a lot of owners to do some basic massage, and then because I want to give them some responsibility back. I don't want them to come to me and say, "Here's my dog. I don't know what to do. Please help." Yeah. But I want to give them something to do that for themselves. So.
Owner empowerment is a very, very powerful tool as well.
Yeah, and I had an owner once, and he came after I hadn't seen him for a while, and then he came back and he said, "Well, could you please look at my dog and help him, because his back is hurting and I can't fix it anymore." And he told me that his dog, when its back was hurting, approached him at night when he sat watching television or whatever, and put his back to the owner, saying, "Here, it hurts here. Can you do something about it?" It's so nice, because such simple thing as learning an owner to do some massage, some basic massage, makes a lot of difference, because they notice much earlier that something's wrong and they react. So I think that's a big thing.
I think if all the owners in the UK whose dogs love a good scratch in a specific location went to see a physio, I think we'd be inundated with work. And something that I really never put two and two together was those really kind of like sensitive but almost pleasurable areas that they're like, get in there, and you scratching away and they're like going, this feels amazing. And I never really thought it was anything more than superficial. I always assumed it was itches or tickles or something. But now I know what I know. I'm like, oh, Hannah, good God. So the one that I quiz myself is when dogs really love a good rub behind the ear. Well, that's a major insertion point of a huge amount of muscle in the neck. And the neck tends to be, you know, it's the stabilizer. It gets affected by everything, and it's a coper. You know, it's there going, it's okay, guys, I'll take this. You know, the back end's not working so well. I'll use my neck more to get from a sit to stand. I'll use my neck more, throw my weight forward. So the neck takes quite a beasting, you know, through different ailments, be it front end, back end. So all the muscles in the neck are working harder and performing more, and they're shortening and they're getting tired and they're getting sticky and they're becoming kind of knotted and spasmy. And then up where they insert on the back of the skull and around the atlas is where these dogs love you to get in there.
Yeah.
Does that mean something? So that sort of thing, you know, when you feel a dog at the back of the skull, just in the neck, and you feel that it's kind of got really quite well developed and it's really rounded off and it's developed, and you're like, that's another indicator that something's going on. You can feel up there behind the ears, you can feel that it's toned, it's well developed. You're like, there's something else going on in the back of this dog. And scratching over the lumbar area, so just lower back where the pelvis is, and you're getting in there.
Oh yeah.
In it, and then pushing their back into you, and you're like, underneath. So any owners that are like, oh my God, my dog loves being scratched, just have a think, is there something there?
Yeah, it's the same thing when you brush them and you feel that they push against the brush, like, oh, more. It's not without a reason, and it's not simply because it's nice. It's often, and also if you look at dogs that want to roll on their backs, and especially on when the not on a flat surface, but somewhere where there are stones or a grass is more uplifted, and they really want to wriggle their backs like that. That's because of a reason. That's not simply because it's nice.
Yeah, totally agree. I've had quite a long day. It's been a long couple of days, and I can't wait to get home for a glass of wine and to put my back on one of those physio rolls. I'll be rolling my back up and down, up and down.
Yeah, right.
Such a good feeling. But so it's things like that, owners, you know, please don't overlook those. What sort of other things do physios regularly recruit when they're managing cases that have chronic pain, compensation, myofascial changes? What other tools would you?
Well, now I'm suddenly, because it's the end of the day for me too, I'm suddenly without words. What's it called? When exercises, of course, exercises.
Therapeutic exercise.
Yes, that's it. We use that a lot. And of course, I can't say stretch your leg or do whatever, but I can look at the dog and think, when would he do what I want him to do? And then we kind of try to talk them into it. And I have also the owner, of course. The owner is always there, so I can ask the owner, when does the dog do this and that? So can we have an exercise for him doing that? We do a lot of exercises, and I always give home exercises.
Yes,
because it doesn't stop in the practice, you know. If they come once or twice a week to the practice, that's not enough. You have to do something on a daily basis.
No, totally agree. And I think it was, I can't remember, it was maybe David Dykes, Carrie Adrianson, I can't remember who it was, but No dog should be seen for a rehabilitation consult, no matter what, without having some kind of homework, a home management.
Yeah.
And I think that's a chat to you therapists that are watching this. You know, make sure within your consultation there is a snippet of time to give them some homework to maintain what change you've elicited. You might use handouts. There's a lot of programs out there now, these therapeutic exercise online programs that you can prescribe, and they've got little videos and diagrams. Or you might have to just do it descriptively and just say, right, you know, we're going to do a lean to treat, cookies to the hips, cavalettis, you know, lateral stabilization. There's different things. My big tip for therapists there, and I've learnt this the hard way, is be logical. You know, I've got a long list of exercises I'm supposed to do for myself. I'm supposed to do 5 salute to the suns every morning for my back, and I don't.
Keep it simple is the best. Keep it simple and not too many exercises.
Exactly. And also try and incorporate it into what they were going to do anyway.
Yeah.
Because for me, to change my routine of fall down the stairs, get the coffee, get the dog out for a walk, get to work, and go, right, I'm going to take 15 minutes out. I'm going to go into the living room. I'm going to do my salute to the suns.
Yeah.
Just don't. My routine, I always say, oh, tomorrow. I'll do it tomorrow. So a big tip for therapists is think about what their routine currently is and try and integrate it into it.
Incorporate it in the daily routine. And it's very easy to incorporate exercises in your daily walk.
Yeah.
And you're walking anyway, so.
There was a lady that sent us a speeded up video of her daily walk, and she had up and down pavements. She had weaving in between bollards. She had steps up to the town hall and back down, and then up and back down. And she had lean to treats on a little brick wall that she went past. And she just said, that is my routine. And I was like, wow,
yeah,
awesome. So I think our take home there is actually those 2 interventions aren't hugely costly. You know, the 2 things that you've chosen out of all tools that are available, you know, your lasers, your PMFs, you chose those 2, and I find that very, very exciting, because I think for me, financial inhibition, financial constraints is a big reason that this disease isn't managed very well.
Yeah, that's true.
And I think that we need to say to our owners globally that intervention doesn't need to be costly. It can improve the dog's quality of life substantially.
Yeah. But also, I think you can tell to the owners, when they come to us as physiotherapists, they're not stuck for months. They can even come and just get a consultation just come once, and I'll tell them what they can do at home, and that will improve their dog's life already. If they can't afford to come more times, please come once.
Yeah, no, definitely. And I would really, really strongly encourage my profession, the vets that, you know, that hopefully watch these, get a physio in your team, get that's really interested in rehab, be amazed at their knowledge. You know, I will always thank Julia Robertson for opening my eyes, because I just didn't think like she asked me to think, and it was a massive learning curve. And I think the highlight of me doing that diploma was putting it into practice. And one day I was treating a dog's back legs, and he was an English Bull Terrier, and I was just working away, and I obviously hit a spot, and he kicked me like a cow. So I was behind him, and I was just feeling both back legs, you know, going down, checking. I obviously hit the spot because he just kicked out like a cow, and he walked away, and then he reversed, and he walked backwards, and I was like, do it again. I was like, oh God, that's amazing. And it's things like that, you know, just kind of make you go, right, there's a lot to this hands-on approach.
Yeah, but I think what's even more important is work as a team. Because as a vet, you tell the owner something. As a physiotherapist, I tell the owner something. If those two stories are the same, it's so powerful. It's so much more powerful than when only you say it or when only I say it. And when we combine forces and we work as a team. I've been working with my husband for the past 10 years. He's a vet, and we've been working together. And that was so. It was great. I can't find words for it. It was great because people appreciated because they knew that we weren't trying to get more papers or whatever. We're trying both from our own profession to do the best for the dog's benefits.
Yeah.
And
Andy Gardner from Southern Counties explains so well, and just MDT, multidiscipline team, and will bring out the best qualities and the best knowledge base. I'm very lucky. I have just started working in a practice where there's 2 vets, there's a hydrotherapist, there's a physiotherapist, there's 2 nurses, very experienced nurses, and we've got an osteopath joining our team.
Yeah, that's great.
And we learn from each other.
Yeah, that's true.
Yeah, and it's good because we're all quite open to sharing knowledge and not being inhibited about going, I don't know how that works.
Yeah.
Anyway, so back to the owner, because we're at 41 minutes. I can't believe I'm kind of come around for one time, but you're a bit far away. Where are you?
I'm in Hilversum in the Netherlands. It's in the middle of the Netherlands.
Damn it. It's just not local.
No, not at all.
We'll have to drink wine by Skype.
Oh, that would be good.
Back to the owner. Okay, so let's start playing the 10 top tips, but instead of them being rushed, let's talk about them, because I think this is really important. We did some lovely ones with Matt Gurney last night, and let's just see if we follow the same path. So I'm going to start with number 10, and then we're going to go our way down. So number 10 for me is weight control. And I feel so strong about this because at the moment we have a obesity epidemic. We have lots of discussion in the vet world at the moment whether obesity and overweight is allowed to be classified as a disease. So pathophysiologically, it is a disease, but to the owner, psychologically, does that give them an excuse for allowing their dogs to be obese? So at the moment in the vet press, there's a lot of discussion whether it was wrong to make it classified as a disease, because we want owners to realize that it doesn't have to remain a disease. It's something we can reverse. It's something that we have very tight control of. So you know how some people, when they have an ailment themselves, they go, oh, I can't do that because I have such and such.
Yeah.
And there's a worry that if owners go, oh, he's so overweight, he's got a disease. And you're like, no, you can do something about it. Overweightness and obesity, guys, this is a big deal because it's free of charge to correct. Generally, it's not expensive for you to get the weight off the dog.
That's true.
There is a study out showing that 9 out of 10 owners of overweight dogs cannot see that their dog is overweight. So the take home from that is, please either pop to your vets and get their nurse at the vets to assess and say, be honest with me, I can take it. Or get your friend who is a dog lover, a dog expert, to be honest with you. And remember to say, tell me as it is. I don't need you to be kind. Or teach yourself to body condition score, okay? And that's so simple. You need to be able to feel the ribs. My biggest tip to you is run your fingers across your own knuckles, and that's near enough what you should be feeling over the rib cage. Feel lightly like you're baking a cake, touching the sponge, because if you press in hard, of course you'll feel the ribs because you're out of the way. But run your fingers lightly over those ribs. And if you aren't feeling bone, then your dog is carrying excess weight. And it's not just a weight on the joint carriage, it is a source of inflammatory mediators, which means that it will make the pain of the arthritis worse. And we know this 100%. Every expert around the world agrees that the most important thing that you as an owner can do is make sure your dog is the right body weight. Can you add to that?
That was not one. That was not only tip 10. It was 9.
That was one tip. So that's number 10, and it drives me nuts. I work at a regenerative facility, so we're doing stem cells. We spend a lot of people's money. You know, it's a very expensive procedure. So having these dogs come in and they're 7 out of 9 body condition score, and we're just about to implant stem cells, and I'm sitting there going, give the stem cells a chance to work. You're basically, you know, putting this therapy at risk of not having a chance to work. So there you go. I've had my rant. Number 9. Number 9 for you.
Number 9 would be learn your dog in early life to use a step to get onto some higher surface. Lots of people start doing that when their dog isn't able to jump into the car or on the couch anymore. But that's too late. Learn your dog in early life to use what I often use for people, and that's very handy and cheap, is you know those foldable crates that you can use for your groceries?
Yeah.
Put them upside down, put a little bit of a tapestry on it, and then your dog can use them to get into the car. It doesn't cost anything, and it's easy, cheap. You could put it in the smallest car. If you learn your dog to use them, it'll be useful when they get older.
I love that. We should see if we can get some cam color crates. And you never know. You might have funded Cam. You know, financially viable.
Put a Cam logo on the side, upside down.
Yeah, and I think that's a great idea, because I definitely have found that I am more successful with managing these cases if I can help it fit into an owner's life. And if an owner knows, well, that is a multifunctional crate, I can use it for my shopping and it's there for the dog. Perfect. Love it. Okay, my number 8 would have to be, it's the home. It's always the home. Let me tell you a story about a case I saw today. So I saw a dog who has got quite significant lumbosacral pain, iliopsoas pain, hip pain, has also got elbow pain, and has been on a management plan. It's been a regenerative case, so we have used stem cells, and it was doing really, really well. And then it deteriorated quite dramatically in the last month. And it has got quite painful lumbosacral junction, so therapists, L7, S1, there's a little gap where we put our epidurals and stuff. If you put some digital pressure on there, that is a pretty good indicator if you've got discomfort underneath in what's called the lumbosacral junction. And this dog, you were just touching, whoa, and just touching the back legs, whoa. The dog was totally hyperalgesic all around its back legs. So basically normal sensation, slightly uncomfortable sensation was being really bad to that dog. The dog was like, that really hurts. So I'd potentially say it was even allodynic. So those are a couple of words for you, Cam follows. Hyperalgesia is where something that is minorly painful, such as a little pinprick, feels like a stab. And allodynia is where just simple touch feels painful. And people with sciatica have a kind of allodynic type thing, because when people brush past them or touch their skin, they're like, oh, that's really sore. So this dog wouldn't let me touch its back end. It didn't like it. It was really, really uncomfortable. But as I started to question them more and more and ask them and repeatedly ask them, turns out they live in a 3-story house. And the dog goes up and down the stairs quite regularly. And their dog also hates the postman. And the dog also doesn't like people going past the house. So this dog would do stuff, and the owner is not at fault at all, because she was just like, well, the dog's capable. That's what the dog does. It wants to do it. It's chosen to do it. And I was like, yeah, I know, but unfortunately the dog's brain and body aren't talking to each other at that point. So the dog was, able, but it wasn't right for that dog. And I think a lot of people think just because they can, they're okay. No, quite often they shouldn't. And I've got another good story that demonstrates this. I had this dog that I could hardly touch. It was really sore. And I went to the home and we couldn't do massage. We could only but change the medication and look at lifestyle. And the dog had this thing for pigeons on the lawn, and the back door had a glass bottom section. See the lawn, and the pigeons, as soon as they landed, the dog would run through the house, get up so much speed, it'd slam into the glass door. And that dog, at that time when it saw the pigeons, didn't think I'm sore. It just had this behaviour that gave it obviously some reward. It was a pleasurable experience for the dog to do that. So it would do it again and again and again, but it wouldn't connect that was actually creating its pain problem. And when we put some translucent, opaque glass on, the dog's condition improved dramatically. So please kind of think about the home environment. I've learnt my lesson. Holly was doing the stairs with lumbosacral disease. I learnt the hard way. Don't make the mistakes that I've made. The home environment can have a massive, massive impact on your dog's level of comfort. God, I rambled.
Can I give an example of this? Because I once had a patient, and that it reacted very well on the therapy, but every time when it came back, it was at the same level of pain again. And I was wondering why, what's happening. So I always question, and that's, I think, a tip for the therapist: always ask about the home situation. Always be sure that you know what happens. I thought I had asked whatever I had to ask, but what I found out was that this dog, whenever the owner came home, or there was someone at the door, it raced to the door and it started turning very quick. So, and it had back problems. So every time when I had done the therapy and it was right again and it went home, the owner went away, came home again, and the dog was starting to turn again. And so, of course, you can't avoid that completely, but you can put a carpet on the slippery floor so the dog doesn't go slipping wherever it goes. And it improved the situation of the dog.
Yeah, and there's countless stories like this. Like, there was another lady whose dog at feeding time would jump up at the counter.
Yeah.
And
things like that.
Yeah, and that dog, again, lower back problem. They take home message, they will still do things even if it hurts.
Yeah.
I surf, even though I come off the water and go, God, that's a bit sore, because I get pleasure out of it. And dogs will do the same. If something provides them some ounce of pleasure, they'll push through. And I've seen dogs that, the ball throwing, the frisbee throwing, the stones in the water, the people that walk the same walk, and they have done for 5 years, and the dog always throws itself in the ditch.
Yeah.
They can't stop it because that's what the dog's always done, or postman, or, guests, and the dog jumps up. There's loads and loads of things that will exacerbate a condition that we're trying to help you with. So get the freebies in.
Yeah.
Get that stuff sorted. Number 7 for you.
I think it's more or less what you already said. It's think for the dog. Because we are the ones who can think this action causes that reaction, and the dog can't. So stop throwing things. Stop, those terrible things where you throw a ball very, very far.
A ball launcher.
Yeah, things like that. Please stop doing it. Because if you want to do something with a ball, hide a ball somewhere, or do something that doesn't cause the dog to run and then hit the brakes and turn around and things like that, because those are the movements that have so much impact on the dog.
Yeah.
So think for the dog.
I think for owners, it's not your fault, because I know
No.
I've just been buying Christmas presents and I've got a couple of youngsters in the family. And if you open a children's book, a dog is either with a bone or a ball.
Yeah, true.
Always. You know, if you see an advert for Vitality of Life, the dog
it's
launch through the air, catching a ball and landing, you know. So owners automatically believe that when they purchase a dog, they have to also buy a ball.
Yeah. Buy a ball or a frisbee or throw a stick. Yeah, that's what makes dog happy. Yeah.
And I just, please, can we stop this?
Yeah.
100%.
Do you know how many Labradors have arthritis in their toes, from their front feet?
I know, so sad.
Yeah.
And so if the dog was used to having its feet dried and it's starting to kind of pull away from you, think about the tool.
Yeah.
And especially when you see toes and the digital arcade starting to collapse. Oh, camera. So digital arcade means that they're on their digits, so the digital pads and their metacarpal or metatarsal pad. And when you start to see them doing that, and then they kind of start doing this and stuff, they've lost a coping strategy. That's part of their mechanical coping strategy of weight bearing, movement, concussional, distribution of forces. There's something going on there.
Yeah. And you see those toes getting bigger, the joints getting bigger.
Yeah.
And it's so easy to see.
So easy to see.
Yeah. When you know it.
Yeah. But the thing is, though, let's help the therapist out here and let's chat a little bit about digital OA, because if you open up any textbook, there's very, very little in there. So I chatted to Karen Perry Butler about this, and like surgical interventions for digital arthritis are lacking. It's basically removing the joint.
Yeah.
Making it a free floating joint. Arthritising them, so cutting the joint out and fusing the bone doesn't work, because you don't want a toe that's permanently like that. So surgery, not great options. With regenerative and intra-articular, so the PRPs, the stem cells, the HAs, maybe there's some hope, but that's quite labour intensive. It's quite a few joints here. With regards to therapists, people are using a lot of laser, ultrasound, massage, heat therapy. What other things would you add to digital OA management?
Well, actually, now I'm going to disappoint you. Because, sorry, but I find that there are very little therapies that really, really help. I've seen the best results with acupuncture and with shoes.
Yes.
If you have shoes with vibram soles, the thick soles that prevent dogs from feeling every little stone that is underneath their feet, they benefit best from that. And I've been disappointed all my life about that, because whatever I do, it's never enough.
No.
It never really, really helps.
No, it is a really difficult one. And be careful of your shoe purchases, guys, because you don't want them to be cumbersome and for them to becoming a trip hazard. They need to fit appropriately.
They have to be broad enough, and it's very difficult to measure the feet right and to make sure that you have the right feet. But I do think it's important to have a sole that prevents the dog from feeling every bit of uneven surface underneath the feet, because that makes a lot of difference.
Yeah, definitely. So don't do what a lot of people do, which is now get on Amazon and just buy the first pair of dog shoes that you find. It is more complicated. I probably spent about £200 on trying different anti-slip shoes on Holly, and I really struggled to find anything that I felt was really good. And the same applies to these therapeutic paw kind of protectors. Don't just willy-nilly purchase.
No. Make sure that you don't have these floppy feet afterwards. And if you want something non-slippery, I don't want to make an advertisement for certain things to buy, but there are these little balloon-like features, and I think they're great if you want to prevent your dog from slipping away.
Yeah, no, they are.
You hardly feel them, and they can feel everything underneath their feet. So we're not talking about osteoarthritis now, but simply prevent the dogs from being from slip away. Buy those balloon-like little.
They're called paws. PAWZ.
Yeah.
But be careful because the ring at the top is quite tight. So make sure that you don't.
The right size.
Yeah, there's a really good YouTube clip of somebody that just snips the top and just uses tape so that each time she makes sure it's not constricting that area. We don't want that. I've lost what number we're on. Is it your turn? I think it's your turn.
Never mind.
Number 5. Say you're number 5.
Oh, okay, it's number 5. But I think what I really think that's very important. Make life. Well, you know what we normally do when we see that someone's having trouble, we try to make their life easier.
Yeah.
But one thing you shouldn't do is stop walking your dog to make its life easier. Because if you see every time that your dog goes out that it's hurting and it has a hard time standing up and it's slow, and please keep your regular walks, maybe even make them shorter, but on a more regular basis. And I know that's often hard because as an owner, we also have work. We don't have time to walk our dogs all day long. But if you try to find a way to walk more frequently and less long.
Yeah, I think that's a good one. And walking is in the home. You could, if you work from home, you could make a little course around your house, things to step over, incentivized. You know, I knew somebody that bought loads of those foam rollers and they're called spaghetti, where people have them in swimming pools and they're long foam, and they cut them in half and put them down a corridor. So there was about 8 of them, and just stepping poles around the house. They did a few little weave poles. So I think you're absolutely right. And to be fair, to quote David Dicus on this, you know, dogs should be able to be doing 10 minutes consistent, solid walking. And if your dog can't do that, then you need to be looking at its pain relief.
Oh, yeah, definitely. Yeah.
Yeah. So walking and movement is essential. So if people are telling you, oh, rest up, don't do anything with him, just do less and less and less, you're going to make the situation worse.
Yeah.
You need somebody to help you with your pain relief protocol, and then you need to get the dog up and moving. Love it.
But remember, the same goes for your mother or your grandmother.
You say that, Ian. Your mother.
Your grandmother.
So number 4 for me must be that everybody in that household has a role and plays an important part. So make sure that the family, the house members, the lodgers, the housemates, whoever they are, understand what you're doing and how important it is. So as a first opinion vet, I hear this all the time. It might be the wife comes in and says, yeah, I'm doing really well, but my husband doesn't think any of it's necessary. Or, you know, I'm doing really well, but he lets the dog jump in and out of the car, and he doesn't say it's important. Somehow you need to work out how to work as a team. And we at CAM really believe that communication is essential and it's foundational. So that's why we created all the booklets. So the booklets that we have in the shop, and we've got about 12, and I think we're going to have 17 at the end of it, are topics that you need your family to understand. And there might be, what is arthritis? How do I know my dog's got it? So if you've got the husband or the boyfriend that doesn't believe you, here's the booklet. It's 40-page, easy read. You can sit on the loo and read it. It could be on the coffee table. It doesn't matter. but they need to understand your treatment protocol, and they need to be part of it. Even if they're not actively part of it, they need to respect it.
Yeah, and even if they're not actively part of it, they should not do something that's counter. What's it called?
Counterproductive.
Right, that's what I meant. Yeah.
Yeah. No, absolutely. Number 3 for you. Thanks, Lynn. Good plug.
No, number 3 would be give the dog an alternative thing to do. So do some nose work, brain work, things to keep them busy and keep them active and keep them, make them feel that they still worthwhile and they still can do something.
Yeah. And that, again, so similar to humans. You know, what we did in our teenage years, in our 20s and our 30s will change through our life. Our hobbies might change. So you might have been somebody that used to play squash, but you now play badminton. Or you might have been somebody that used to run long distance, but now you do shorter, park runs. We inherently change what we do to our capability. But for some reason, we don't apply the same principles to our dogs. We seem to go all or nothing, and then, oh, he's old, let's stop.
Yeah. But yeah, if you doubt whether it's still good for your dog to do your sport, well, and then of course we talked about the annual assessments. I think that as a therapist, it's our one of the things we should do is inform the owner what sport that is still doable for the dog. There are a lot of sports down there that you can still do when your dog has osteoarthritis. You can still do man trailing or maybe what's it called with the big balls? Hoopers, for instance. Yeah. Wow.
I love it.
Yeah.
I've had too much coffee, so anything that you say now, I'm just like.
I didn't have enough, so
No.
now after an hour, it's getting less. My English is getting worse.
No, we've got 2 more to do. So number 2 for me, and then you're going to do the finale. So number 2 for me, I would suggest incorporate a complementary therapy. I really feel that there is an array of therapies out there that are financially affordable for most people. As you said very politely, seeing a physio, it might be a one-off, but they will give you the tools to add that to your management plan. It might be that you see a massage therapist, a physiotherapist, a hydrotherapist, a laser therapist. I am the converted. This is why CAM exists. I wrote CAM after doing the myotherapy diploma because I just couldn't believe how narrow-minded I had been and how massively influential these additions can be. And Matt Gurney really stepped outside the comfort zone yesterday. I went, incorporate acupuncture. And it's like, I agree. Incorporate massage. It's a very powerful tool and it isn't costly, and you can learn different techniques in safe zones on your dog, these compensatory areas that will give that dog a really good quality of life and relief from some of that secondary discomfort. So don't poo-poo the complementaries.
Yeah. I mentioned acupuncture already. I think it's I can't do anything, you can't do anything, but as a team we can do a lot more.
Definitely.
But I'm always for teamwork.
No, I know. And that's the thing, is that people keep saying to me, how can you spend so much time on just arthritis? Why are you not bored? Have you not finished learning? I'm like, no way. It's huge. And you therefore, to be able to have all the skill that's needed, be it nutritional knowledge, acupuncture, surgical knowledge, behavioural knowledge, no one can know all that. You have to be a team. Number one
is not essentially number one is just a tip, but I think it's for a lot of dogs with osteoarthritis, it's a good tip. watch what kind of bedding does your dog have? What kind of cushion or what, I don't know what you call that in English, but make sure that it's not too wobbly. It's very difficult for a dog with arthritis in its feet or with back problems to step on a wobbly surface.
Yeah.
So please make sure that it's firm, that they can easily get into it and not have all these difficulties with their balance, because that's hurt.
Yeah, and just so you guys know that the terminology orthopedic mattress is not regulated.
No.
You could go into a pet shop and you could buy a orthopedic bed, and it's no one's testing, no one's checking trading standards that actually fulfills requirements for an orthopedic bed. So a big tip for me is, go to Canine Equipment Review page on Facebook and you'll hear about dog beds. Find someone to talk about. We have a couple in the shop, so I really do rate the Big Dog Bed Company. That's a big push for them. They produce some fantastic beds. They're not stunningly attractive with glitter and bows and fluff, but the dog doesn't really care about that either. They want to make sure it's warm, safe, sturdy.
From the floor, a bit from the floor, no drop. Yeah.
No drafts, and non-slip for when they get out of bed, because that's when they're most vulnerable. So yes, Canine Equipment Review page, go to it, tell people what you found that have helped. The lovely May was talking about those little booties called paws. Go to that page, tell people what amazing products you found to help others. We're a community, that's what we try and do.
Yeah.
I wanted to know more about dog beds. Well done. Well, there you go.
We answered it.
Yay. Thank you so much. You're amazing. Beautiful. Amazing. We would love you to come back. There is so much to talk about with regards to.
I think so too.
I know that there is definitely more interest in being a bit more specific. So I know that we've had a number of people saying, please, can we talk more about a modality such as hydro? So,
okay. Yeah.
So if you ever felt that you would like to come and empty your knowledge, we would love to have you.
Well, I'd love talking to you, and you know that I'm dedicated to this work, so I'm there when you want me to be there.
Thank you. And I was chatting to somebody else the other day, and I was just like, if I have that same enthusiasm, it was Siobhan Menzies. I don't know if you've met her. She's over in Ireland. The clips will be out shortly. We're talking about CBD. And she's been doing rehab now for 17 years. She's been a vet for 30 years. And people keep telling me that I'm passionate. And I was just like, oh my God, you're off the Richter scale. So if I am anywhere near like you two, I'll be pretty proud of myself. So
I think you are already, but you can always try to be more enthusiastic, but it's hardly possible.
Thank you. Well, have a lovely Christmas, and we will see you guys. I think it's after Christmas now. We're done until 2nd of January, and he's not going to get out of this now because we've got an absolute superstar joining us. We've got Daryl Millis, 2nd of January.
Wow.
I know. I'm hoping he's not going to let us down, so I'm going to keep saying it. Daryl Millis.
He won't. He won't.
Can't get out of it now. So that's going to be a biggie for the new year. All right. Thanks, May, and we'll catch you guys later.
You're welcome. Okay, bye. Have a nice Christmas.
Cool.